Snoop Dogg's 24-year-old daughter suffered a severe stroke last week. Corey Broda shared the news on her Instagram story. Previously, she had been outspoken about being diagnosed with lupus when she was 6 years old. It's a chronic autoimmune disease. It causes inflammation and pain in various parts of the body. Last September, Snoop's daughter spoke to people about her lupus battle and how she got off her meds cold turkey to take an holistic approach. Joining us now is Anne-Marie Blacketer, the CEO of the Lupus Gulf Coast chapter, to discuss the dangers of quitting medications and going all natural without consulting doctors first. Welcome. Thanks for being here.
Good morning.
Obviously, you can't speak directly to this position, and we have to be careful with that.
Right.
But what is your advice for somebody who wants to change up their approach a little bit and how to safely go about that?
You know, lupus is, first of all, lupus is real.
Yeah.
I think that's the hardest thing for people to kind of grab a hold of. And it can be life-taking if it goes untreated or undiagnosed. So anytime we want to talk about medications, any changes to those medications, always, always, always consult with your main doctor, which in this case is likely a rheumatologist, to make sure that they, as your quarterback of care, are, thank you, CJ, are actually being able to manage what steps you're taking. We have to keep up with managing our disease regardless of how we choose to use our drug interactions.
And I just want to make sure for anybody who says, wait, what is lupus? I've heard about that. So a lot of times it's known for the butterfly rash across the face, but then so much more.
So much more.
Like we mentioned earlier, pain is involved. It affects a lot of body parts.
It does. A dear friend of ours calls it the equal opportunity organ destroyer. So a stroke is actually a symptom of lupus. Believe it or not. You might remember our friend Cheryl.
Yes, of course.
And Cheryl actually suffered a stroke as well before she was diagnosed with lupus. It's part of what lupus can do by attacking nervous system, the heart, kidneys, the lungs, the skin, the hair. It's a nasty little sticky widget, as we often call it. So treatment is important, and to get to treatment, you need diagnosis.
So do some of the treatments out there prevent some of those life-threatening symptoms besides the painful ones, life-threatening like strokes?
There are opportunities to suppress the immune system, which is our hydroxychloroquine, methotrexate, which
People may know that is a chemotherapy.
A chemotherapy drug, and those are made for other things. There's 3 drugs made for lupus, only 3 made for lupus when there's millions of people living with lupus in the U.S. today. Primarily women of color, and primarily childbearing age. Those treatments specifically for lupus can help keep the symptoms at bay if they work for you. So the Safnellos, the Benlistas, and all of that of the world are able to help us thrive despite lupus. Managing how we eat is good for anybody.
Sure.
I would love to say I don't eat Girl Scout cookies, but I'm pretty sure Girl Scout cookie season is coming up, right? And that's a personal choice that I get to make of whether or not I eat those. I'm going to eat them. So I think we all have to manage those choices for ourselves.
One thing that is so frustrating for patients, every lupus patient I've ever talked to, sometimes they went for years without the correct diagnosis because it can be tricky. It can mimic other things. What's your best advice for somebody who has some of the symptoms that you mentioned earlier about how to start this treatment plan and get it going?
And thank you so much for asking that question, because truthfully, all we have to do is ask your doctor, what if it's lupus? It's just that simple. If you have a butterfly rash, extreme fatigue, extreme unilateral swollen joints, you want to ask your doctor, what if it's lupus? And we have a lupus warrior right now in a hospital system without rheumatology. And we are trying desperately to get her to a hospital with rheumatology service because she has lupus SLE. So it's not just we have to advocate for ourselves. We actually need our doctors to understand lupus, know that lupus is real, and help us advocate as well to get the treatment that all lupus warriors deserve.
Well, I highly encourage anybody to just check out your foundation. You do so much to make a big difference for patients right here in our area. Thanks for coming in today.
And local matters.
It does. It does make a difference. All right, thanks for your time.